Arsenic trioxide vial is used to treat a specific type of leukemia called acute promyelocytic leukemia, or APL. It is given as an injection into a vein by a healthcare professional. The dosage and timing of administration will be determined by your doctor based on your specific condition. Be sure to follow your doctor's instructions carefully. Before starting to use arsenic trioxide, it's important to read the patient information leaflet if available from your pharmacist. This medication is given by injection into a vein by a healthcare professional over 2 hours as directed by your doctor, usually once daily. If you have a reaction to the medication such as dizziness, flushing, or fast heartbeat, the injection may be injected more slowly, such as over 4 hours. The dosage, treatment schedule, and length of treatment are based on your weight, medical condition, and response to treatment. Your doctor will order tests, such as EKG, blood minerals, to find the right dose for you. Your next dose may need to be rescheduled if your heartbeat or blood tests are abnormal. It's important to follow your doctor's instructions and ask them any questions you may have. Some common side effects of using arsenic trioxide vial include pain, redness, or swelling at the injection site, nausea, vomiting, diarrhea, stomach or abdominal pain, tiredness, cough, headache, and dizziness. These side effects may improve over time, but if they persist or worsen, it's important to notify your doctor or pharmacist immediately. It's important to note that while there may be serious side effects associated with this medication, your doctor has prescribed it because they believe that the benefit to you outweighs the risk of potential side effects. Your doctor will closely monitor you to help reduce the risk of serious side effects. Both leukemia and this medication can lower the body's ability to fight off infections, so it's important to notify your doctor if you develop any signs of an infection, such as a persistent sore throat, unexplained fever, or chills. Serious side effects that should be reported to your doctor right away include increased thirst, signs of kidney problems, bone or joint pain, decreased appetite, muscle pain, numbness or tingling, swollen hands, legs, or feet, symptoms of liver disease, chest pain, severe dizziness or fainting, fast or irregular heartbeat, coughing up blood, mental or mood changes, muscle weakness, bloody or black stools, vomit that looks like coffee grounds, or signs of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. Additionally, people treated with this medication may rarely develop other types of cancer, so it's important to consult your doctor for more details. It's also important to note that while a serious allergic reaction to this drug is rare, you should seek medical help immediately if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report side effects to Health Canada at 1-866-234-2345. Arsenic trioxide is a medication that can cause serious side effects, so your doctor will monitor you closely during treatment. This medication may rarely cause a serious condition called APL differentiation syndrome. Tell your doctor right away if you experience unusual fever, difficulty breathing, or sudden weight gain. Your doctor may also perform certain exams or tests to determine if this syndrome has developed. It can also cause serious heart problems, so tell your doctor if you have any history of heart or kidney problems, or if you take any medications that increase your risk for these heart problems. Your doctor may order a heart rhythm test or blood tests before and during treatment. If you experience severe dizziness, fainting, or fast/irregular heartbeat, get medical help right away. This medication may also increase your risk of getting a rare but very serious brain disorder. Get medical help right away if you experience clumsiness, weakness, sudden changes in thinking, difficulty talking/walking, or vision changes. Before using arsenic trioxide, make sure to inform your doctor or pharmacist if you have any allergies or if you have a medical history of kidney disease or diabetes. Arsenic trioxide may affect the rhythm of your heart, causing serious symptoms that require immediate medical attention. The risk of this happening may be increased if you have certain medical conditions or if you are taking other drugs that can also affect your heart rhythm. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems. It's important to talk to your doctor about using arsenic trioxide safely if you have these conditions or if you are taking certain medications. This medication can make you feel dizzy, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this drug affects you. Arsenic trioxide can also make you more susceptible to infections, so it's important to stay away from anyone who has an infection that can easily spread. You should also talk to your doctor if you have been exposed to an infection for more details. Make sure to inform your healthcare professional before getting any vaccinations, and avoid contact with people who have recently received live vaccines. To lower the chance of getting injured, use caution with sharp objects and avoid activities that could result in injury. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using arsenic trioxide. This medication can harm an unborn baby, so reliable forms of birth control should be used during treatment and for a certain period of time after the last dose. If you are breastfeeding, it's recommended to consult your doctor before continuing to breastfeed while using this medication. It's important to be aware that arsenic trioxide vial may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are many drugs that may affect the heart rhythm, including amiodarone, dofetilide, and others. It's crucial to report all medications you are currently using to your doctor or pharmacist before using arsenic trioxide. Some products that may interact with this drug are drugs that lower blood minerals, harm the immune system, or cause bleeding/bruising. Aspirin can increase the risk of bleeding when used with this medication, but if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, usually 81 to 162 mg a day, you should continue taking it unless your doctor instructs you otherwise. Ask your doctor or pharmacist for more details about the best time to take this medication and any concerns you may have. If someone has taken too much arsenic trioxide vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call 1-800-222-1222 for their local poison control center, while Canadian residents can call their provincial poison control center. Symptoms of overdose may include seizures, muscle weakness, and confusion. During your treatment with arsenic trioxide vial, your doctor may perform various lab and medical tests to monitor your health and the medication's effectiveness. These tests may include checking your electrolyte levels, complete blood count, EKG, blood glucose, liver function, and thiamine levels. It's important to attend all scheduled medical and lab appointments and consult your doctor for more information. As for the usage of arsenic trioxide vial, the dosage will be determined by your doctor based on your medical condition and response to treatment. It is typically given intravenously, and the frequency and duration of the treatment will also be determined by your doctor. Arsenic trioxide vial is used to treat a type of blood cancer called acute promyelocytic leukemia, APL. It works by causing the cancer cells to die. It is important to take this medication exactly as prescribed by your doctor. The best time to take this medication will be determined by your doctor based on your individual treatment plan. Remember to follow your doctor's instructions carefully and report any side effects or concerns during your treatment with arsenic trioxide vial. Make sure to take each dose of arsenic trioxide vial as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action. This medication is not meant to be stored at home and is administered in a clinic by healthcare professionals. It is used to treat a type of blood cancer called acute promyelocytic leukemia, APL, in patients who have not responded well to other treatments. The dosage and timing of administration will be determined by your healthcare provider. Make sure to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.